Here's the uncomfortable truth. Blurry eyes aren't just a part of aging. Doctors don't always tell you this, but behind those blurry moments could be conditions that are entirely preventable or even reversible. Why isn't this common knowledge? Stick with me as we uncover the top 10 causes of blurry eyes and the secrets to protecting your sight. You know, I get it. It's easy to brush off blurry eyes as just getting older. Maybe it happens when you're reading, watching TV, or even driving. Just a slight blur that comes and goes. It doesn't feel urgent, right? But here's the thing. Blurry vision isn't always a natural part of aging. I've met many people who thought the same thing. Some of them wished someone had explained these things to them earlier, and some regretted not acting sooner. That's why I'm here, to make sure you don't miss what could be warning signs. In this video, we're talking about the top 10 causes of blurry eyes after 60. I'll not only explain what's happening to your eyes, but also show you simple steps to protect your sight and enjoy life with clear, healthy vision. Let's get started. 10. Dry eyes. Let's start with one of the most overlooked causes of blurry vision: dry eyes. You see, as we age, our eyes naturally produce fewer tears, which means the surface of the eye doesn't stay as moist as it should. Tears aren't just for crying. They're essential for keeping your eyes healthy and your vision clear. When they're lacking, your eyes can become irritated, itchy, and blurry. You'll often notice the blurriness after a long day of staring at a screen, reading, or even being in a dry environment, like a heated room during winter. It feels like your vision goes in and out of focus, almost like your eyes are struggling to refresh. It's frustrating but easy to ignore until it becomes chronic. If left untreated, dry eyes can lead to more serious problems. The constant dryness can damage the surface of your cornea, increasing your risk of infections or even scarring. That's why it's so important to address it early. Artificial tears, taking regular screen breaks, and using a humidifier can help restore moisture and prevent long-term damage. 9. Cataracts. Cataracts are one of the leading causes of blurry vision in older adults, and they're incredibly common. Picture this. It's like looking through a foggy window or trying to see through a pair of smudged glasses. Over time, the lens in your eye becomes cloudy, which affects how light enters your eye. Suddenly, colors seem dull, and reading or driving at night becomes a real challenge because of glare or halos around lights. What's tricky about cataracts is how slowly they progress. At first, you might not even notice the blurriness, but it gets worse over months or years. Some people adapt without realizing how much clarity they've lost, until it's too late. Ignoring cataracts can lead to severe vision impairment and, in extreme cases, even blindness. The good news is that cataracts are completely treatable. With a simple and safe surgery, the cloudy lens can be replaced with an artificial one, restoring your vision almost instantly. But waiting too long can make the surgery more complicated, so don't delay those regular eye exams. 8. Presbyopia. This is one of those causes that almost everyone faces as they get older. It's called presbyopia. It's the reason you start holding menus or books at arm's length to read them. The lens in your eye becomes less flexible with age, making it harder to focus on things up close. Presbyopia isn't painful or dangerous, but the blurriness can be incredibly annoying. It's constant when looking at something close, like a book, sewing, or reading your phone. You might even notice yourself squinting more often or feeling strain after doing close-up tasks for a while. While presbyopia doesn't lead to permanent damage, ignoring it can affect your quality of life. Left unaddressed, the constant strain on your eyes can lead to headaches, fatigue, and frustration. Thankfully, it's an easy fix. A good pair of reading glasses, bifocals, or progressive lenses can make your world sharp again without any hassle. 7. Uncontrolled diabetes, diabetic retinopathy. Now, this is one that's both common and dangerous if ignored. If you have diabetes, you already know how important it is to manage your blood sugar levels. But did you know that high blood sugar can actually damage the blood vessels in your retina? This condition is called diabetic retinopathy, and it's one of the leading causes of blindness worldwide. The blurriness from diabetic retinopathy is tricky because it doesn't follow a pattern. Some days your vision might be fine, and other days it feels like you're looking through a foggy haze. This happens because fluctuating blood sugar levels can cause swelling in the retina or even temporary changes in the shape of your eye's lens. If diabetic retinopathy is left untreated, it can lead to severe complications like retinal detachment or permanent blindness. That's why it's absolutely critical to control your blood sugar, attend regular eye exams, and act quickly if you notice changes in your vision. Early treatment, like laser therapy or injections, can prevent the condition from worsening and save your sight. 6. Glaucoma. Let's talk about glaucoma, often referred to as the silent thief of sight. And for good reason. It sneaks up on you without obvious symptoms until significant damage is already done. Glaucoma occurs when the pressure inside your eye increases, damaging the optic nerve, which is crucial for transmitting images to your brain. What makes glaucoma scary is how subtle it is at first. The blurriness usually starts at the edges of your vision, creating blind spots that you might not notice until they become larger. You might also have trouble seeing in dim light or experience eye pain, but many people don't feel anything at all until it's too late. Ignoring glaucoma can have devastating consequences. Once the optic nerve is damaged, the vision loss is permanent. In severe cases, it can lead to total blindness. But here's the silver lining. With early detection, glaucoma can be managed. Medications, eye drops, or even surgery can lower the pressure in your eye and protect your remaining vision. The key is regular eye exams to catch it before it becomes irreversible. 5. Age-related macular degeneration, AMD. Here's a big one. Age-related macular degeneration, or AMD. This condition affects the macula, the part of your retina responsible for central vision. Imagine trying to read, recognize faces, or even watch TV, but the center of your vision looks blurry or distorted. That's AMD, and it's one of the leading causes of vision loss in older adults. AMD comes in two forms, dry and wet. The dry type progresses slowly, and you might notice a gradual blurring in the center of your vision. The wet type is more aggressive, caused by abnormal blood vessels leaking fluid into the retina, which can lead to sudden and severe vision loss. If ignored, AMD can make even the simplest tasks, like reading or driving, nearly impossible. While it doesn't cause complete blindness, losing central vision can severely impact your independence. The good news? Early detection is critical. Lifestyle changes, like a healthy diet, quitting smoking, and taking certain supplements can slow down dry AMD. For wet AMD, treatments like injections or laser therapy can preserve your sight. 4. Refractive errors, uncorrected vision problems. Refractive errors might sound technical, but they're just a fancy way of saying your eyes aren't focusing light properly. Conditions like nearsightedness, farsightedness, and astigmatism fall under this category. While these are common at any age, they often worsen as we grow older, especially if left untreated. The blurriness from refractive errors is constant, but varies depending on the type. For instance, nearsightedness makes distant objects blurry, while farsightedness affects your ability to see things up close. Astigmatism, on the other hand, distorts vision at all distances, making things look stretched or wavy. Ignoring refractive errors can lead to more than just inconvenience. Over time, your eyes will strain to compensate, leading to headaches, fatigue, and even difficulty focusing on tasks. Thankfully, the solution is simple. Updating your prescription glasses or contact lenses can instantly sharpen your vision. Regular checkups with an optometrist are key to staying on top of these issues. 3. Retinal detachment. This one is serious and often comes without warning. Retinal detachment happens when the retina, the thin layer of tissue at the back of your eye, pulls away from its normal position. It's like the screen on your phone starting to peel off, and if it's not fixed, the phone stops working. The blurriness from retinal detachment is sudden and often accompanied by other alarming symptoms, like flashes of light, a shadow or curtain over part of your vision, or a sudden increase in floaters, those little specks or strings you sometimes see drifting across your field of vision. Ignoring these signs can have devastating consequences. If the retina isn't reattached quickly, it can lead to permanent vision loss. This is a medical emergency, so if you notice any of these symptoms, don't wait. See an eye doctor immediately. Surgery can often save your vision if it's caught in time. 2. Stroke or transient ischemic attack, TIA. Did you know that blurry vision can sometimes signal a problem far beyond your eyes? A stroke or a transient ischemic attack, also known as a mini-stroke, can cause sudden vision changes. This happens when blood flow to the brain is temporarily interrupted, and if it affects the areas responsible for processing vision, you might experience blurriness, double vision, or even partial blindness. The key difference here is that the blurriness is usually sudden and may only affect one eye or a specific area of your vision, like the upper or lower half. It's often accompanied by other symptoms, such as slurred speech, weakness on one side of the body, or difficulty walking. Ignoring these warning signs is incredibly dangerous. A TIA is often a precursor to a full-blown stroke, which can have life-altering consequences, including permanent vision loss or worse. If you experience any of these symptoms, it's critical to seek emergency medical attention. Fast action can save your life and your vision. 1. Eye infections and inflammation, uveitis or keratitis. Finally, let's talk about infections and inflammation, a less common but still significant cause of blurry vision. Conditions like uveitis, which is inflammation of the middle layer of your eye, or keratitis, an infection of the cornea, can strike quickly and lead to serious complications if ignored. The blurriness from infections is unique. It's often accompanied by redness, pain, and sensitivity to light. You might also notice discharge from your eye or feel like something is stuck in it. These conditions can develop after an injury, wearing contaminated contact lenses, or even as a result of autoimmune diseases. If left untreated, infections and inflammation can cause permanent scarring, damage to the cornea, or even blindness. The key is to act fast. Your doctor might prescribe antibiotics, anti-inflammatory eye drops, or other treatments to stop the infection and protect your vision. Never ignore pain or redness in your eye. It's your body's way of signaling that something needs urgent attention. So we've covered a lot today, the top 10 causes of blurry vision after 60. Let's do a quick recap to tie it all together. Blurry vision can be caused by something as simple as dry eyes or presbyopia, where the solution is just a good pair of glasses or artificial tears. But it can also signal more serious conditions like cataracts, glaucoma, or even diabetic retinopathy, things that can silently steal your sight if ignored. And let's not forget about emergencies like retinal detachment or the warning signs of a stroke, where acting quickly can save your vision, and even your life. Here's the takeaway. Blurry vision is never something to brush off. Pay attention to the patterns. Does it come and go, or is it constant? Is it affecting your central vision, or just the edges? These details matter when it comes to figuring out what's going on and getting the right treatment. Regular eye exams are your first line of defense. And if you notice sudden or unusual changes in your vision, don't wait. See a doctor immediately. Your eyes are too important to take chances with. If you found this video helpful, don't keep it to yourself. Share it with your friends and loved ones who might also need to protect their vision. And if you've ever experienced blurry vision, let me know in the comments. I'd love to hear your story and answer your questions. Finally, if you want more tips and advice to stay healthy as you age, make sure to hit that subscribe button and turn on notifications. I've got plenty more content coming your way, from eye health to overall wellness. Until next time, take care of your eyes. They're your window to the world.